My name is Connor McCarley, and my special population is the homeless in the United States of America. According to the If the World Were 100 People video, 23% of the world does not have shelter, so homelessness is an issue everywhere that must be addressed. Predisposing factors. Some of the factors that help lead to homelessness in the United States are mental illness and drug and alcohol addiction. One population that suffers from mental illness and homelessness are veterans. Often after returning from war, they have a hard time adjusting to civilian life and thus suffer mental disorders and sometimes end up on the streets. Around 38 to 42% of homeless men are veterans that suffer from mental illness. Post-traumatic stress disorder is one of the major disorders that affects veterans in modern times, and sometimes this disorder can make it extremely rough on veterans trying to assimilate back to civilian culture. Drug and alcohol addiction also plays a major role in creating homelessness in the United States, as many people will become dependent on drugs or alcohol. Around 30% to 40% of homeless people suffer from alcohol abuse, and 10% to 15% suffer from drug abuse. Individuals can sometimes become so dependent on drugs and alcohol they may choose drugs and alcohol over rent. Enabling factors. A few enabling factors in the United States are the ease in which alcohol and drugs are accessible and the lack of accessibility of mental health services. Drug and alcohol use have been proven to increase an individual's vulnerability to homelessness. When drug and alcohol abusers become homeless because of their addiction, it can lead to a vicious cycle. Without outside help, it can be almost impossible to overcome. Many people end up homeless due to a nagging mental health issue, and once they are homeless, their access to mental health services dramatically decreases. Homeless individuals lack the financial resources or insurance to help themselves overcome their disorder. Some individuals suffer from mental disorders and drug or alcohol addiction, and this can make an already poor situation even worse. These are some of the issues that chronically homeless individuals have to deal with on a daily basis. Needs characteristics. Since many homeless people have mental disorders, they are sometimes not aware of their health situation. However, it has been proven that the older that the homeless person is, the more likely they are to realize their health issues. The older homeless individuals usually seek help at shelters more often than the younger homeless people. As they age, older homeless people begin to realize that they may have an issue. Younger homeless people tend to shift their blame away from themselves, as they cannot believe that they are responsible for their situation. Those who suffer from addiction will less likely believe that they need help until a traumatic event occurs to push the risk of drugs and alcohol and other mental disorders past the inconvenience of being homeless. Many homeless people do not realize that they need help, so it must be up to others to help enact change in their lives. Here are some discussion questions to ponder. 1. How are drug or alcohol addictions and other mental health issues affecting the homeless population in the United States? 2. What can be done to alleviate some of the issues plaguing the homeless in the United States?